Hello, everybody. I'm Rob Wallace. I'm an evolutionary epidemiologist with the People's CDC, here with an update on the COVID-19 pandemic. In the graph in red, the Johns Hopkins Coronavirus Resource Center reports a continuing decline in world COVID to 4.2 million new cases for the week ending May 1st. That's good news, but over 4 million new cases in a week's time nowhere near represents the end of the pandemic. The number of global weekly deaths there in white continues to decline, down to a little more than 18,000 deaths for the week, the lowest level since March 2020, when SARS-2 went pandemic. The number of vaccinations administered this week there in green saw a significant boost to nearly 117 million new shots administered worldwide, still well below vaccination levels of late 2021 and early 2022. Global declines don't mean every country's COVID is disappearing. This New York Times map shows that we still have hotspots over the past week in Europe, Asia, and Australasia, with France, Germany, Italy, Portugal, Austria, Greece, Finland, South Korea, Australia, and New Zealand continuing to be epicenters in average daily new cases per 100,000 population. Benin in Africa appears a new hotspot, and the United States, South Africa, and Uruguay have moved up in daily caseloads per population. By this Our World in Data time series of daily confirmed COVID cases per million people, the present hotspots like Australia and New Zealand and Germany aren't anywhere near at the case rates that Hong Kong, South Korea, and Denmark hosted earlier in the year, but indicate that despite the overall decline in global caseload, COVID under Omicron is still very much surging here and there. The time series are also colored here by test positivity, showing Australia, New Zealand, South Korea, and Finland in the brown, clocking in at 30% positive rates and more. Deaths per million population finds Hong Kong and South Korea off their Omicron peaks, with steep declines in daily deaths. Since its February peak of 2,500 deaths a day over a 7-day rolling average, the United States underwent a steady decline in daily deaths, but is still hosting 330 deaths a day, including a slight uptick the past couple days. Finland, which we highlighted a couple weeks ago and highlight here again, went through yet another surge in daily deaths per population. Omicron's death load isn't merely a matter of the virus, but also depends on each country's governance, including decisions about whether to roll back public health interventions. The decline in global deaths was muted by a World Health Organization analysis suggesting that COVID's global toll is vastly underestimated. In contrast to the 5.4 million confirmed deaths on record, the WHO estimates nearly 15 million have died from COVID up through December 2021. The present global declines are meanwhile not synonymous with a SARS-2 that is on track toward evolving a lesser deadliness as a matter of course. Nor is SARS-2 evolution over. Tulio de Oliveira's team reports new Omicron subvariants BA4 and BA5 in South Africa, there in the yellow and orange, are presently demonstrating daily population growth advantages of nearly 0.1 over previous subvariants BA2 and BA1. Big picture, we need to keep in mind that a large literature in the modeling of viral virulence shows that increasing transmissibility is not necessarily accompanied by a reduction in deadliness. Meanwhile, Alex Siegel's lab shows infection with Omicron BA1 does not offer antibody protection against the new BA4 and 5, particularly in the unvaccinated. Just because you got infected in the Omicron rush of early 2022 just a few months ago doesn't mean at this point you remain in the clear. In much of the world, unvaccinated is in that kind of danger. With Haiti, Guatemala, Pakistan, Eastern Europe, and Africa under 50% vaccinated, even for just a single vaccine dose. It's a failure in vaccine access almost entirely a matter of Gates Foundation-led efforts to preserve intellectual property rights for pharmaceutical companies over the needs of global health. Turning to the U.S., cases per 100,000 population the past week are creeping up on the West Coast, especially in Washington State, the Northeast, and the Midwest, particularly Minnesota, Wisconsin, and Illinois. Epicenters appear emerging along the southern side of the Mason-Dixon line, including Kentucky, Virginia, West Virginia, and North Carolina. Pinpricks of outbreaks are apparent in Washtenaw County in Michigan, Webb and Loving counties in Texas, and Stephens County in Oklahoma. Puerto Rico appears fully embroiled in a widespread outbreak. Here are the levels of SARS-2 detected in the wastewater that comes through our sewage plants. The CDC compiles these reports showing for April 17th through May 1st high levels in orange and red in the Bay Area, Colorado, northern Illinois, parts of New York State, and North Carolina. But only a few states are reporting these data, and we have no new reports from what were sharp outbreaks in New York City, Washington, D.C., southern Florida, and elsewhere in the Northeast. With health departments rolling back testing programs or switching to home rapid antigen tests that patients are under no obligation to report in, the U.S. is finding itself increasingly in a fog about the very nature of the prevalence of stateside COVID. The changes in SARS-2 in these sewage plants over the past 15 days, showing here in red some sites around the country with increases over 1,000% or more, particularly in Illinois, Wisconsin, Ohio, Michigan, Missouri, parts of Colorado, and Los Angeles. We do see declines in upstate New York and Utah, but it's only a few states that report these data, and for some states only from a few sites. And present epicenters are entirely missing, including Washington State, New York City, much of the Northeast, North Carolina, and parts of Texas. Carnegie Mellon University offers daily reports of the prevalence of COVID symptoms in selected U.S. counties. Here's the map as of May 1st. Like the wastewater maps, it's intriguing, but also geographically incomplete, and it depends in part on self-reporting. With Omicron, with a reputation as a relatively benign infection, and hospitalizations requiring ICU beds flat for most of the country, we also see, however, in some blue areas there, that we have upticks of 2% or more in ICU beds being filled in the past week. How much more than 2%, CDC does not report. Where does the CDC think the U.S.'s COVID outbreak is presently overall? In February, the CDC introduced a measure of alert called community levels based on COVID hospitalizations given the capacity available, which as of April 28th shows most of the country largely out of danger in the green, although even by such a lagging marker as hospitalization, the Northeast is suffering increasing exposure. It's this map CDC highlights on its website. You have to dig to find a map of CDC's previous alert system based on actual county transmission. The April 28th transmission map shows that Alaska, Hawaii, Puerto Rico, the Four Corners again, now Michigan through Minnesota, the entirety of the Northeast down into Virginia, as well as South Texas and Florida, registered as high in community transmission. Some areas in green or low in the CDC's community levels map now flash red or high under the measure of community transmission the agency has now largely abandoned. Letting COVID circulate, sloshing back and forth across the country, allows the virus to rebound. It also allows it to evolve. The U.S. is itself a source of new subvariants. Evolutionary biologist Trevor Bedford reports that Omicron subvariant BA2.12.1 shifted from only 1% of new infections in New York State in early March to 18% by April 1st. Massachusetts hosted a similar, if not as dramatic, increase in the new subvariant. Much as in the global picture, Americans are largely unprotected. Full vaccination is geographically uneven, with counties largely distributed in the South, Appalachia, Southwest, and the Rocky Mountains region, with county-level rates of full vaccination as low as under 30%. Yet the Biden administration and politicos of both parties are treating COVID as if the pandemic is over, moving on to other crises, including Ukraine, and suddenly the Supreme Court's reversal of Roe v. Wade. Clearly, war and access to reproductive medical care are key problems in public health. But the objective is to return to the business as usual that, while lucrative for a few, helped produce the pandemic in the first place. And in fact, given many of the CDC's changes in COVID policy, including reducing recommended quarantine from 10 days to 5, also helped continue the pandemic. Clearly, the GOP and their Supreme Court appointees are patriarchal to the extreme, and they are also negligent on COVID. But the Democrats also followed employers' leads in rolling back COVID protections in a way that placed the largest COVID burdens, including the crisis of long COVID infections, on disadvantaged and marginalized populations, black and brown people in rural communities of all colors, willfully encouraging risk-taking while also pretending equity remains a central pillar of the party's platform. The present outbreaks of COVID in New York City are largely concentrated in wealthier neighborhoods, for instance, Lower Manhattan and Riverdale in the Bronx, where many people are pretending COVID is over. These outbreaks are likely to spill over into poorer neighborhoods with people without the similar resources in health, money, and time off. A people's public health organized around the well-being and welfare of the American people and humanity overall must be moved front and center, and actualize the democracy the U.S. ruling class pretends it represents. And that's this week's COVID report from the People's CDC. You can learn more about the People's CDC and read this week's COVID weather report at peoplecdc.org.